Hey everybody, welcome to today's daily vlog, a little video. 80% of what we deal with here at Freedom Physio and Pilates is back pain. That can be back pain with or without leg pain, otherwise known as sciatica. And it's an incredibly large problem, and in my opinion, on the whole, incredibly badly managed. Okay, so we could probably argue that as a population, we consume way too much in the way of painkillers and particularly anti-inflammatories, and they're simply not good for us, and they're covering up the problem, not really getting to the actual cause of why we're getting back pain. Now, this whole COVID-19 issue that we're dealing with today, and the lockdown, coming out of lockdown, and having clusters, and there's a lot of stress. There's a lot of sitting, a lot of work from home. So perhaps the last 2 or 3 months, I've seen a lot more back pain. And one of the things that I guess we've got to talk about and have a conversation about is how can we improve back pain? How can we get better at managing spinal pain? And one of the key things is to look at expectations, what your expectations might be, okay? What drives people to book in to see a physiotherapist or their doctor or a massage therapist, osteopath, chiropractor, whatever. You know, what are they expecting? We know based on data that right now, 25% of adults have back pain, but most people, probably only 4 out of 30 are actually doing something about it. So the percentage of people who actually pick up the phone or go online and book an appointment is quite low. There's a lot of information on YouTube, there's a lot of stuff in social media, there's a lot of salesy stuff out there. And I think one of the key things that we are trying to do is we're trying to empower you to improve yourself. So there's a couple of things I look at when someone comes to see me, and the most important thing is we need to understand you as a person, your life, your work, your hobbies, your family, your sport, your exercise, to understand why you are seeking help, to understand what you've tried before. A lot of what we do here is we deal with a lot of people who've been everywhere looking for a quick fix. And I think the most disappointing thing that people hear here is, I listen, okay, I've done this, I've done that, but nothing seems to last. I need to be fixed. And I tell them, in 25 years of clinical practice as a physiotherapist, I've never fixed anyone. My role is to listen, get your story, get your context, map out what your goals are, what it is you want to do, what's holding you back, what's frustrating you, and try and develop an approach, an educational approach, an exercise-based approach that helps you understand why you're hurting and the things that you need to do to get to the root cause of the problem and to be able to take control of pain, to take control of back pain. Sure, we use our hands, absolutely. Sometimes a bit of hands-on manual therapy helps you get moving, but the key thing here is education, understanding, helping you take responsibility for taking control of your pain. So it's a very holistic approach, but what we aim to do here is to empower you to improve yourself and to sustain that improvement and to be able to move forward in life having taken control of your pain. In fact, if we can teach you really, really well about why you're hurting, what you can do, the causes, the exercise program, the lifestyle changes you need, then you're in a position, hopefully, to be able to help others. I'm not saying you should go out there and become a health professional, but if we teach you well, we are helping you understand yourself and how you might be able to advise others, hey, stop taking all those anti-inflammatories, they're bad. You need to do something about it. You need to go talk to a proactive physiotherapist who's in a position to actually help you take control, get some independence over your life, keep your mobility and do the things you want to do.